this video, we will review the clinical toolbar. The clinical toolbar provides a physician and clinical staff convenient tools to enter clinical information during a patient visit. Please note the viewer, progress note, and RX writer will not be reviewed in this video, for they are reviewed in their own separate videos. We're going to begin with the info button, which is the first button here on the clinical toolbar. When you press on this button here, it will show you the patient's demographics. This is a read-only screen. It's more as a reference point, but you'll be able to see the patient's name, their address, their email, date of birth. Also, you'll be able to see if the patient has registered for the patient portal from this screen here as well. You can also check the patient's insurance to see what type of insurance that they have if you needed to. This is a reference only. It cannot be changed. It cannot be altered in any way. You can see I can click on the patient's name and the screen does not change. It just allows the provider or staff to be able to see more information as far as the demographics for that particular patient. If anything needs to be updated or changed, you would need to go out to the actual demographics for that patient in order to update or change. And again, the viewer, progress note, and RX writer will be reviewed in a separate video, so they will not be reviewed in this video here. So we're going to move on to the orders. This order button here allows the user to be able to create a lab order, a diagnostic imaging order, or a procedure. You'll notice here on the top we have the patient's demographics. You even have the last appointment that the patient had. If there's a next appointment scheduled, you can see that they have vital signs here as well. If I hover over the number, same thing with their medications, allergies, and diagnosis. Here you'll see your order type. Are you ordering a lab? Are you ordering a diagnostic image? Or are you ordering a procedure? We're going to start with the labs here. You'll see here that my ordering physician is already listed for me. If I need to change that ordering physician, I can do so just by selecting from one of the physicians in the dropdown who are in my practice. A facility, I can add a facility of where that patient is going to go to have that lab or to have that procedure. And you can put in just the name. You can also narrow it down by city. You can narrow it down by state and zip as well. So if I wanted to make this a little bit shorter of a list, I can narrow it down by state as well as too. And I can also do it by zip code too. I can also copy the results just by selecting one of the providers here from the drop-down. You'll notice that this top list here is the patient providers. These are any providers that are linked to that particular patient. And then below that is your practice provider, so that if you wanted to copy somebody in the practice, the results you could as well. Maybe the provider is going on vacation during that time when the patient will be having that particular lab, so you want to copy another provider within that practice. You can just do so by putting the check mark in their name. You can also look up physicians as well here. We recommend using last name and then city and state, and then you can look them up that way. Just hit search and then pull them in. Diagnosis, selecting from the drop-down, you'll see that the problem list populates first. So these are the problem lists that is listed on the patient's problem list. And then below that is the favorites, which is based off of the provider that is listed in the user's batch. Now you have your due date here. If there's a particular due date that it's required, you can select it. And if it's 1 week, 2 weeks, it could be 3 months, it could be 6 months, depending on what type of lab it's going to be. You can also select a date here if need be. If you have an in-house lab and you're doing the collection there, you can enter in the collection date and time here. If it's afternoon, morning, or evening. Your frequency, is this a single order, or is this an order that's being repeated? Is this something that this patient needs to have every 3 to 6 months. You can select if it's a single order or repeat, and you can put any notes that you need for the patient here. And below here, this is where you're going to select your test. Now, depending on who your provider is selected in your batch, will be depending on what favorites will be listed underneath your testing here. You'll notice that I changed my physician here. So now I have a new set of favorites that are listed here. Favorites are based off of provider and not individual user. So if I wanted to select a order from my favorite, I could just put a radio dial in that. If I needed to look up a particular lab, I can select this magnifying glass here. And when I do that, it brings us into our ordering section here where we can look that up. And you'll notice that it's lab tests. We can either search for description, we can search for LOINC code, or an order code. Now, order code is the number that CareTracker gives the order when it's created inside of the company. Every time an order is created, it's given an order number. In this way, it's for tracking purposes. So that's what that order number is. LOINC codes are codes that are given to certain particular tests as a tracking capability as well. A lot of times you might hear a LOINC code related to meaningful use back in the day, and now MIPS current day related to lab results is LOINC codes. You can also search by begins with or contains. And then you have your search text box here. Now, this search feature here is based off of the facility that you have listed right here. So if you have like a LabCorp in there, LabCorp might call a particular test one thing, Quest might call it another thing. There might be another lab out there that calls it another thing. So depending on what facility that you have listed here, you might have to play around with the search features here. If you leave that facility blank, it's more of a generic search area. So I'm just going to put CBC and hit search. So you'll notice when I hit CBC, these are the 3 options that I have here. Now I can add these to my favorites if I needed to. I could just make sure that I select the little star here. That would be yellow with a plus sign to make it part of my favorites. I put in another option here for thyroid. So you'll see I could order a TSI, or I could order a hyperthyroid panel. And I could also put this on my favorites as well, just by clicking this little yellow star with a plus sign. And that will put that on my favorites. So that way, next time I go to order that particular order, lab order, I don't have to go through this search feature. I can just select it from my favorites. So you'll notice that I've brought that now hyperthyroid panel in. If I ever needed to manage my favorites, I can click on this star right next to the magnifying glass, and that's going to open up to my manage favorites list. And you'll see that it automatically defaults to my lab tests. So this way I can either add to this list if I wanted to, if I wanted to build my favorites list. So that way I spend a little prep time beforehand building my favorite list, because these are the type of orders that we prescribe in my scope of practice. And I don't want to have to search from each time I need to prescribe them, because it's something that we prescribe for our patients regularly. Or if I needed to remove a favorite because we no longer do that type of testing or look for something like that, or it's changed. So I could always select the X if I needed to delete it, and that would remove it from my favorites. If I wanted to add, I can click on the magnifying glass and now look for the particular test that I'm looking for, and then add it to my favorites here. You also can add to your favorites as well in here as far as your SIGs, your pharmacy notes. You can manage those as well. Anytime that you see that star without a plus sign, it's going to bring up your manage favorites list, and it allows you to manage each favorite list that you've created. So we'll close out of that there. So you'll see that I still have my test here. I can now mark if this has been a routine test or if it's a stat test. I can put in any type of test notes that I want to tell the laboratory about this particular test. If this is something that I want to, contact me immediately before they leave, I could do that. I can also make favorite test notes as well, just by selecting this star here. I can manage my favorites here, and I can add my test. When I add my test, it now brings it down into my test summary. So you can see here's my hyperthyroid panel, my urgency is routine. Because I had a test note, you'll notice that my little scanner here is highlighted blue, and if I highlight over it, it tells me to, please contact as soon as possible. If I needed to edit this particular test, I could select this. If I needed to start all over again and I wanted to remove it, I could hit the remove button here. Now, the one thing about orders or lab orders or procedures or x-rays is that I can't order a whole bunch of orders all at once. I can't just click one button and have 5 or 6 different types of lab orders that I would do for a panel for a patient to happen at once. I would have to add them in each individual each time and come back up and kind of start that process over again, where now I would start and add in a different order. So there's a way that the system will work to your advantage if you want to do like a panel or a group of particular orders, and I will actually review that next. But here you'll notice that we have a send, a print, a fax. You can put it in a to-do and a record. Now send, some laboratories are bi-directional, and what that means is that you're able to send lab requests to them. And then once the patient goes and has the lab work done, they send you back the lab results electronically. That's called bidirectional. Now, majority of lab interfaces currently interface with CareTracker are unidirectional. And what that means is that you are not able to send the lab request electronically to them, but you can print it out and give it to the patient, and that way they can bring the script to the lab. Once the patient has the lab work done, it's processed, the lab would send the electronic results back into CareTracker, and that's unidirectional. So in that example there, you would select this print here, and once we save, we would be able to print it out. If you are connected to MyFax, which you're able to fax out of CareTracker, it's a third-party company that we have partnered with, you would be able to fax this out of CareTracker to the lab that you wanted to fax it to. You can send it in a to-do where you might be sending it to an MA, asking them to, print this out for a patient, or, make sure the patient knows the importance of this, that they have to get it done now. It could be for any reason that you're sending them in a to-do. And then if you just want to record this, you might not want to print this out right now. You just want to record it so that way you can print it out at a later date. You can have that option as well too. I'm going to leave this on print. You'll also see that there's a mark complete here. Sometimes you're entering in maybe a lab test as a record purpose. So you want to mark this as complete because you're not looking for the result. You're just maybe as a record purpose because you might have an in-house lab and you want to have as a record. If you needed to create another order, you can select Save and New, and it would save this particular order and allow you now to prescribe the next order. So I'm going to hit Save. And when I do that, it's going to ask me for that PIN number that was set up when the provider entered in their electronic signature. I enter in the PIN, and it's going to pull up that script for me now to print out to give to the patient. And this is what the script looks like with inside a CareTracker. Now, also with orders, again, you can now order x-rays as well too. Not only x-rays, you can order mammograms, you can order CTs, ultrasounds as well. That would be underneath your diagnostic imaging. And again, you can change your provider here if need be, and it will change the favorite list that's listed here. You can select the facility as well if you have them set up for your provider, if they have a favorite facility that they deal with. Copy results, patient providers. Those are the providers that are linked to that particular patient. And they don't necessarily have to be providers that are in the practice. They could be somebody who sent over a continuity care document, and it was scanned in. It could be a specialist. And then below that is your patient provider. So those are the providers that are actually inside of the practice, that are part of your particular practice. Diagnosis, it's the same as a lab. It's going to show you the patient's diagnosis first, and then the favorites that are saved for that particular provider. And I'm going to leave my facility blank. And in here, and I typed a mammogram, even though the terminology is mammography, but we refer to it in layman's terms as a mammogram, and you'll notice that nothing came up. So now if I just typed in MAM, I do have more options that I can now select from. And again, it all depends on what is selected as far as your facility. I have a generic facility, or compendium that they call it. So sometimes putting a mammogram would work. Sometimes just put in mammography. I just put in MAM, and now I can select what I need that test to be. And I can add the test. And again, I can do save and new if I wanted to. And again, this diagnosis is required. So you notice that I selected save and new this time, and it saved that particular order, but it also brought back up the screen for me now so that I could add another lab order. I could add in a diagnostic. Maybe I need to add in a procedure. And procedure also could be used for medical equipment as well. Maybe you need to order crutches. Maybe you need to order a wheelchair or a walker, maybe a special boot. It could be a number of different medical equipment that you might need to order, and they might need a script for that particular order. So you can use the procedure and be able to now prescribe with an order crutches, a wheelchair, a walker. It could be a specialty boot. It could be a knee brace. It could be a specialty arm brace. And that would be filled out the same exact way as well. So moving on from orders, we also have what you call order sets within inside a care tracker. And order sets is this next button here, allows a practice to set up sets. You can set up a particular panel of blood work that you would send a patient, along with maybe x-rays that you would send with the patient. Maybe they're a new patient to the practice and you run a panel of blood work, maybe a chest x-ray. Depending on the scope of your practice, it could be a lumbar x-ray. Maybe there's education that you want to give them. Maybe it's a particular medication that you give, depending on the blood work, and so forth. These order sets can be set up by provider, by group, or by company. So if I click on the provider one, you'll see here that it highlights it in orange underneath, showing me that I'm underneath the providers. And when I look at the provider order sets, it's automatically highlighted underneath Kyle Dunn, who is the provider that I have with inside my batch. And these over here are all of Kyle Dunn's particular order sets that have been set up for that particular provider. If I was covering for somebody else within the practice, I could always go to theirs as well, just by clicking on their name. And they can be all the same, and they can be different. It all depends on the scope of the practice, depends on the providers, if they want to share their templates per se. If not, it can be set up as an individual basis. So I'm going to go back to Kyle here, and I'm going to select my annual physical orders. So you'll see here, underneath my annual physical orders for my provider, I have a medication. I have lab tests. There's 2 particular lab tests here. I have a diagnostic imaging for a chest x-ray, a procedure. I also have some patient education, and I also have a recall as well, too. Now, I didn't have to go into the order screen and create 3 different orders, then create a procedure, then create a diagnostic imaging. I didn't have to go into patient education, which is a separate button, or go into the RX screen, which is another button, go into the recall screen, which is another button. I spent some time setting this up so that way by a click of a button, I could order all this at once. Just by selecting either the all, as you notice, it puts check marks in all of them. So that way when I hit save, it's going to print these all out for me. I can also select my particular pharmacy for that patient. So if there's a pharmacy linked to the patient in their demographics, I can select their pharmacy and I can order the medication just from right in the screen here without having to go into the Write Script screen to do that. And I can just hit save. Now, in a normal environment, you wouldn't receive an error, but I also am in a training environment. Now, with regards to setting up an order set, that's actually done with inside the administration options for the practice. So in your administration, you want to go to the clinical tab in the middle, and you want to go to order sets, which is underneath the daily administration. In here, you'll see provider, group, and company. So if there's anything set up, depending on which one you select it for, this is where you'll see them listed. To create a new order set, you're going to select new order set here with the plus sign on the right hand side. And it'll bring up your order set screen. So you want to give your order set a name. What would you call this particular order set? Now it could be for anything. It could be if you're a specialty and you do a set of labs when the patient comes in. If they're brand new to your practice being transferred in, they might have to go for a set of labs depending on that specialty. So it might be 6 or 7 labs that you send them for. You could create whatever that might be. It could be like a new patient blood work. It could be a general wellness exam, depending on what the scope of your practice is. And this is really up to the practice of what they want to call it. Because again, you want it to be familiar to the people within inside the practice. So I'm going to call it general exam. And now I would select if I want to do this based off of a specific provider, or if I'm going to do it for the whole group. So that means that everybody that's in that group has access to it, or do I want to do it for a company? I'm going to select it for a particular provider. And you'll see that my provider here is automatically selected for me because this particular provider is in my batch. But if that's not the provider that I want it to be set up for, I can always select from the drop-down and change that provider. So now I can start with a diagnosis. If I wanted to add a diagnosis to it, I can just select this little magnifying glass here, and I'm going to say wellness. So this is for a wellness examination. So now I've pulled in my wellness examination here. Now, is there any type of medications that I need to add to this? Is this something that I would prescribe medications for? If it is, I could always look up that medication. Here, you'll see that you have that contains or begins with, and you type in the medication you're looking for and hit search. And if you're looking for generics, you just make sure that you include that generics. Check mark here and hit search. Now, for a wellness exam, I'm not really prescribing any medication at this point. I'm just doing the preliminary work to see if I do need to prescribe medication. So I'm not going to add in a medication, but now you'll see my order set selections over here. I can order it a lab test. Maybe there are particular labs that I want to be sending out. I can select a facility if I want to. If there's a particular facility that I might be interfaced with, I can select the facility. If not, I can leave it blank. And now I can look for my lab tests here. So we're going to do now it's going to ask me for this particular test, is it routine or is it stat? Fasting, I'm going to say 8 hours. Is there any testing notes that I want to add to it? I can. If not, I'm just going to hit save. So now I can now enter in my next order because again, maybe there's a group that I do for this. So I type in what I'm looking for here. We'll go with this one here. And again, it's going to ask me, do I want fasting? And you'll see here that I just clicked on the plus sign so I can see all the ones that I've selected. And maybe now I want to do another one. And this one I want to do fasting. So now I've entered in all those lab tests. So I don't have to do that save and new each time and then have to go back and print it out. They're all here and I can order them all at once. Maybe there might be some diagnostic imagings that I want to send as well with this particular general exam. So I can select my diagnostic imaging tab here. And again, I can select a facility if I needed to, or I can leave that blank as well. So now I'm going to order a chest x-ray. We'll do this one here. If I needed to edit that, you can see I can edit. If I wanted to, if I may have selected the wrong one, I could always hit the X as well too. If there's any procedures I wanted to order, I could. There's no procedures that I needed for this one. Patient education, I can add in patient education to print out, or I can, send it in a to-do if need be. So I can click on this here, and it brings me out to my patient education search. So I can use my search, or I can use a tree. You'll see here, I just put a check mark into the education that I want to add, and then down below here, add education to order set. So now that adds it to my order set here. I can add in a recall if I needed to. This particular one doesn't need a recall, so I'm not going to add that in. And now I can save and close. When I save and close, if I go back into the chart, it's going to allow me now to select that particular order set for the patient. So I would come back into order set under providers, select that provider, and then look for the one that I saved and be able to print them all out at once. And again, you can save them by provider, by group, or by company, all in the admin section there. Moving on from the order sets, we're going to go into immunizations. Now, this immunization here is if you are administering the immunization within inside of the practice. And depending on the scope of your practice, you might not administer immunizations. So if that's the case, then you would not need to use this particular button. So I'm going to click on immunizations, and that's going to open up to the immunization screen. So you'll see here, you have the patient's demographics again, and again, it shows that last appointment, next appointment, vitals if you hover over them, medications, allergies, even diagnosis. And then you'll see that it's connected to my encounter here. The admin date's going to default to the date that you open up this screen here. You can be very thorough. It's in military time when it's administered, and it will match your computer clock. And then you would select who's going to administer in the practice. So it could be an MA, it could be an RN, it could be the provider. So you would select who is going to be administering this. If there's an ordering provider, you can select them as well. Then you'll see here underneath your immunization here, you can select the lot number if you've inputted that into the admin options, which I'll show shortly. Just by selecting that lot number, you'll notice that it pulls in what the immunization is, who the manufacturer is, the expiration date, how it was routed, what the dosage was for you. So that way you don't have to add that on each time. You also, if you have not added it into the administration options, you can add the lot number in information right then and there. So you would enter in your lot number here, and that would be off of the package of the immunization or the box for the immunization. You'd enter in the immunization what it is. You can select the magnifying glass to type that in. So I just use influenza as an example. And you can see here, there's a lot of different influenza ones. So depending on what that box says, you just click on that and it pull it in, the manufacturer. The date it was received in the practice, the date that that expires, how many doses are in that particular lot that you have, what's your standard dose, how is it administered, where is it administered, is this state supplied? Now with flu shots, sometimes states will supply that to practices so that way they, get that out into the community. So you want to say if this is a state supplied or not, so that way you know when you have to order again and how many you've administered. And you want to make sure that you say that it's active. And then you would press save, and that would pull that into your lot number here for you. You can also edit the lot numbers as well too, or immunizations from here, if need be. And again, once you put in your lot number and all that information, it automatically pulls it in for you, so that way you don't have to type it in each time. If this is a particular immunization that requires like a couple of injections or shots, what number is this in the series? Is it the first one? Is it the second one? Is it the third one? The site, was it the left arm, could be right thigh, left thigh. The VIS date given, and was it given to the patient? You'll see that it automatically defaults to the date that you're administering. Was there any reaction? You can select from here. Care Tracker has numerous choices to select from. Is there any administrator notes that you need to add to it? You can type them in here. This is a free text box here. Now, for practices who are interfaced with their state registry, they will have right here next to the save to save and send. So when you've administered this, you can send it automatically to your state registry right then and there. I'm in a test environment, so I'm not hooked up directly to a registry. So that's why I only have this save button here. But practices in real time who are registered with their registries would have a save and send. So you can send that to your state registry in real time. So that way you're not having to do it once a week, once a month. You can do it as you are administering those immunizations. Now, again, a little bit of a setup that you can do ahead of time, which would save you time when you're with the patient. And again, this is done in the admin options. So I'm going to go back out to my front screen here. And I'm going to go to my administration options, and I'm going to go underneath the clinical tab right here in the middle. And I'm going to start with the administration maintenance. So underneath my system administration, I'm going to go to administration maintenance. And I'm going to click on that. And what this does is it allows me to check off who in my practice will be administering these immunizations. So that way I can select them from the drop down. Any providers who actually administer immunizations, you want to select them, MAs, nurses. I'm not sure about front desk staff, but anybody who is in your practice that's actually going to administer an immunization, you should have checked off. And you would just put a check mark in their name. And then press save. Then, once that's completed, you want to come over to your daily administration and select Manage Immunization Lots. This is where you can put in your immunizations that you've received in your office. So you can see here I have a list of immunizations. It tells me the lot number that I've entered, what immunization it is, when it was received, how many quantities I have, their expiration dates, and are they active. And if I ever needed to edit them, I can click on the little paper with the pencil and make my changes and save. I can also show you my inactive as well. They would be listed on the very bottom of the list. If I need to add in a new immunization, I can select this Add Immunization Lot here. And it looks very similar to the one that I showed with inside of the chart when you're administering the immunization. This will save a lot of time for the practice if you do it ahead of time, putting in your lot number, looking up that immunization, who the manufacturer is, the receive date, expiration date. Again, the number of doses in that lot, you want to put how many doses you have because each time it's administered, it's going to deduct it from the quantity here. So you'll know, looking at this, when you need to order more or when it's getting close, that you're going to need to order more. And then you would just save. And that way, when the patient comes in for their particular immunization, you just select from the drop-down and you administer the immunization and send it off to your state registry. So I'm going to go back into my patient here. Moving on from the immunizations, we're going to go into attachments or documents. This is another word for documents. So in Care Tracker, there are a couple of different places where you can upload documents to a patient. There's one part of the PM system where you can upload their license, their health insurance cards. There's also a couple of places inside the clinical part of Care Tracker where you are able to upload documents into the medical record. You'll see here, I can either upload because maybe I've saved documents to my desktop and I want to upload from my desktop, so I can upload a document, or I can scan a document. If I have a scanner that has Twain drivers, TWAIN drivers, I can link that to Care Tracker, so that way I can scan directly into Care Tracker. Now, before you're able to scan, you need to install this attachment tool. And this attachment tool will need to be installed on any computer that you're going to use for scanning into Care Tracker. So you'll see here, it just lets you know that this would need to be installed, and you would select the install and then go through the wizard to install that. Once it's installed, you can hit scan and you'll be able to scan that particular document in. I'm going to browse to upload my document here. So again, I can, search wherever I need to. I can search my desktop where I save that particular document. And I can double click on that document and you'll see that it brings it in for me. Document type. Is this clinical? Is it financial? Is it practice? Usually if you're scanning it from the clinical toolbar, it would be clinical. And then what my subtype would be. Now you'll notice that my first options here are custom subtype folders, which you do have the ability to set those up with inside of Care Tracker. And then you also have global folder subtypes as well too. And depending on where you want this to be, or is depending on what you select here. Now remember, if I wanted this to be part of the problems list, or if I wanted to be part of the allergies list, I can select those from here, and it would automatically put that in the section for me as well to be able to see that. You see that my patient's name's automatically here for me because I'm inside of the patient's chart. My provider, this is the provider that's in my batch, so I don't have to select them each time from that drop-down as long as my batch has been set up for the clinical side. If this isn't the provider, maybe I'm covering for another provider, I can always select who that is from my drop-down here as well. If this belongs to a particular group, I can select that group here. I can also link it to a particular encounter. Does this go to a particular data service, a particular encounter? I can select that from here as well. Upload folder, voice attachment, you don't have to worry too much about. This is part of an old voice recognition system and dictation system that Care Tracker used to use for transcriptions. So this is really absolutely kind of obsolete now. We do have some older practices who still use that, so that's why it's still here. You can give it a document name, document date, the date of the document or the date it's being scanned. Batching, you don't have to worry too much about. Care Tracker has the ability to batch scan into the system where you would have to print out a series of labels and kind of put those into the different documents to be able to scan them in, and then this would correlate to the batch number. It's a lot more work than I've made it out to be. You can add any notes that you want to. If this is a confidential note, so anybody who has that override on their operators enroll would be able to view it, but anybody who does not cannot. Yes or no. Has this been reviewed by the provider? Is this something that you're scanning in because they've signed off on it physically? They don't need to review it again. You can mark that as yes. Again, has that provider reviewed it? Have they signed it? A lot of times providers still to this day, when they get in something in paper, will review it and they kind of, put their notes on it, and they might actually sign their name to it because to them they've now signed it off. Have they signed it, or do they need to sign it? If they have signed it, you can change this to yes. Do they need to sign it? Do they need to review it? Yes or no. And then, do you want this to show in that chart section? That chart section has to do with my subtype that I selected here. You'll notice that it says problem list. So it would show up in the problem list for me. And I can add my document. And it'll let me know that my document's been successfully uploaded. And it would close out for me. Now, with folders and subfolders, again, this can be done with inside the administration options. So underneath your administration options, we're going to go to Setup, which is this third tab here. And then underneath your system, Documents and Folders and Subtypes. So in here is where you can set up your subtypes and your folders that you want information scanned into. And again, every practice is different. It all depends on the scope of your practice. So you can have very specific subtypes, very specific folders, how you want this information to look within inside the document management of the patient. It's totally up to the practice of how detailed that you want to be. We recommend creating your subtypes first. So selecting this plus sign next to the subtype here, you would give it a subtype name. So if I wanted, CCDA as my subtype, my document type, clinical, correspondence, financial, patient practice. So depending on where this is supposed to be, I'm not going to assign a folder. I'm going to leave this blank. Care tracker location. Is this like a particular location I want to see this in? Do I want to see it in my problems list? Do I want to see it in my allergies list? My medications maybe, because you do have that ability. Do I want to see this in the progress note? Is there a signature required? Yes or no? And of course you want to make sure that you leave it as active. And then you would select Save. Now, recommendation when you're creating your documents and document subtypes is always to have like a piece of paper and kind of map it out before you start to add them in, what you want your subtype folders to be named. So that way you can add them in all at once. And then once you finish your subtypes, what do you want your folders to be called that are related to those subtypes? So after you finish your subtypes, you go into the new folder here and you would give it a name. So maybe I want to do CCDA. And here's that CCDA that I created. I would put a check mark here. I would now select that and I would save. And you'll see that my CCDA would be now related to my CCDA underneath the clinical. So here's the one that I've created. Does not require a signature, and it is not global, so it's just for this particular practice. And if I ever needed to edit any of these, I can always select the little paper with the pencil, and it allows me to now edit. You see how that folder is now selected there, even though I didn't do that the first time. And that just allows your document management to be a little bit cleaner looking. And just to kind of show you, underneath your documents, underneath the health history panes, these would be your folders, and then underneath them would be your subtypes. To make it a little bit easier if you're looking for a particular document instead of having it just all scanned in under maybe no folder assigned. So moving on, the next button that we want to discuss is recalls. So practices have the ability to create recalls on the clinical side as well as the practice management side. a recall could be used for, you want the patient to follow up in 6 months. So you want them to be called to make sure that they made that appointment. Or it could be, follow up with the patient. Did they get their 3-month blood work done? So you can create a recall with inside of the clinical process as well. And I'll click on that one more time. I do apologize. I am in a training system, so sometimes they're doing updates behind the scenes as well. So you'll see here, it's my patient recalls. It gives me the recall date. If there was a case, I can assign it to our case. I can also attach it to an appointment, a resource schedule, a location if there's multiple locations, any notes, and then what that status is as well. So I can show just my active ones if I needed to. I can show all within this screen. I can edit these recalls as well. Time frame, what appointment type, resource. To create a new recall, I would just select new recall here. And then again, I'm going to select my time frame, weeks, months, years, depending on what that recall can be. And it could be anything. It could be, send out a follow-up letter because it's flu season and come in and get your, immunization. It could be follow-up for blood work. It could be, it's a recall because maybe they had, surgery and, your practice policy is to follow up with them, within 24 hours, whatever it may be. So it could be days, it could be weeks, it could be months. The appointment type, the resource, location. Again, if there's any case, do you want this to be on your EMR alerts? Do you want this to be a soft alert, so it would be part of this little triangle here when you press on it? Or do you want it to be part of the pop-up alert, so when you access the patient's chart, it pops up for you? Is there any notes here? And then active. You want to leave it as active. You can save and send this in a to-do, or you can just save it. So that way it becomes part of the patient's open activities. And then these would be the list of the recalls that have been done or need to be done for that patient. The next button here is your letters. These are your clinical letters with inside a Care Tracker. So when you click on that, it brings you out to this screen here. If you have letters that are saved as favorites, you can select them from the drop-down here, and it will pull up that particular letter for you. Some letters might require a date, and it will pull up that letter. You'll see that there's nothing in this particular letter here. You can also search our database for letters too. So I'm going to search for our global letters. So I'm just going to put a check mark in the global and hit search. And I put consult in my text. So it's going to pull up all those particular consult letters that are global. So you'll notice that global, there's a little ball here. It kind of looks like a globe. And then we have the providers here. And we have like a little bookcase here. So if you have these here, this would be your group logo, and this would be your practice logo here if it was created particularly by that practice or by that group. So I'm going to click on this first one here. It's going to pull that into this here, and now it's going to ask me to select a date. So you'll see here that it populates that consult letter for me. I have my letterhead logo here, who it's going to go to as my consult. It brings in the patient's name for me, and this is all based off of macros behind the scenes. And it actually pulls in the patient's record as well too. This can be saved, it can be printed. You can send this as a to-do to have somebody else print it out. You could fax it if you are using our third-party fax company, MyFax. You can also kind of play around with this too as well if you needed to. It's just like Word here. So, you could put in space, you could put in, commas, whatever you need to be. You can do that as well. You're also able to create favorites too. So if this is a consult letter that you like, or, you find a letter that you like, again, anytime you see a star with a plus sign, you just click on it and it adds it to your favorites. So that way you're selecting from a drop-down versus our library. After your letters, you have your message center. Your message center might look familiar to you from the clinical today. This is where you can send to-dos inner office. You can send email replies to the patient portal. If you are set up with MyFax, you can fax out of. If you're set up with direct mail, you can send a secure email to another provider. So you'll see here, I have my to-do tab. It's going to default to my name, or the user's name, operator's name here. Who do I want to send this to? I can send it to somebody within inside of my practice just by selecting their name here. If I'm sending it to a particular queue, if I have queues set up within my practice, or a particular participant, I can select them as well too. It will have the patient's name already here for me because I am in the patient's chart. So this is one very important thing to note. If you're sending a to-do, you might be in a patient chart doing something and then you want to send a to-do to somebody because it might be lunchtime and you want to know, hey, you know, are you guys going out for lunch? Can you pick me up something? Be very careful when you're inside of a patient's chart when you're doing that because it will pull in the patient's name here and it becomes part of the medical record. So just be very mindful of that. If that's the case, just hit this little X here so that way it does not become part of the patient's medical record. Then you can type in your subject here, what it is. This is free text. It automatically defaults to this, but it's free text. You can type in what you want. If there's a due date for that to do, due time maybe. Inner office. If it's a type, you know, maybe it's something to do with EHR, maybe it's the patient portal. Reason. Could be a phone call, could be a recall, could be a testing follow-up. Is it severity? Is it very high? Is it very important that they call today? Is it medium or is it low? Like it can wait till tomorrow if need be. Your status, you want to make sure that it's open if you're sending it to somebody so that way they can see it. And you can even put a duration in here if you needed to. And down here you can type in the message that you want to send. You can also link patient data as well. Brings you out to the chart summary, clinical summary, transfers of care. You can look up the patient's orders if you needed to, patient education, and you can also add attachments if you needed to as well. And again, you can either upload it from your desktop or you can scan it in if your scanner has been connected. Mail. This is not a secure mail option if you're going to try to mail or email another provider. That's what the direct mail is for. And this is more for if you're going to respond back to a patient. You could do so here. You'll see that you have the ability to see the demographics here as well. But you can look up the patient subject, you know, again, type in what you want. You can link patient data. You can add attachments. Fax, if you are connected and using our MyFax, you are able to fax out of Care Tracker. So you would select who it's going to go to. You can create your own kind of phone book or fax book if you wanted to. You can add fax numbers as well. You can select who it's from. This is regarding the patient, the subject, and again, linking patient data or adding attachments. And then direct mail. So if you're set up with our direct mail, which is a requirement for MIPS, you'll have your own HIPAA compliant email. So you'll be able to communicate securely with another provider if you're sending over a continuity of care document, or you would be able to do it securely. So you can look up who you want to send that to. And it doesn't matter which EHR that they have. This is a global search. So you'll see here, I just typed in the last name Brown, city and state, and I come across this person here. And you'll notice that this person does not have Care Tracker if you look at the direct email address. So it's not just Care Tracker to Care Tracker. It could be Care Tracker to, in this case, Aetna. It could be Care Tracker to Amazing Charts. It could be Care Tracker to Athena, Epic, Cerner. It doesn't matter what EHR that they have. You would be able to locate them. Now with this directory here, less is more. So if you want to do last name, city, and state, first name gets kind of tricky because you might know them as Rob, but they're registered with their NPI as Robert. So you want to make sure that, if you're using a first name, you're actually using the name that they're registered with their NPI with. So nicknames, if you know them as Rob, but their first name is actually Robert, you want to make sure that you're typing in Robert versus just Rob. Same thing with Michael or Mike would be another example. Again, here's your patient pulled in because you're with inside of the medical record, and then your subject as well. You can link the patient data, and you can add attachments. And then you would just hit send when you're sending it to them. You also have access to the chart viewer here too from with inside of the direct messaging as well. The next tab here, the next button is your education. This is your patient education. This is where you can either search for education for a patient. You can use the tree option where you're just now clicking on the plus sign to open it up and kind of drill down into each thing. You also have favorites education. This is where you can manage your favorites. And you can also use links. Links is a very nice feature with inside a Care Tracker that you can put your favorite web browser that you go to for patient education inside and be able to just click from here to open it up into its own web browser without even leaving Care Tracker. So you have the ability to do that as well. The search feature here, you can use contains or begins with, and you would type in what you're looking for here. The language, we have a lot of different languages. Not all education is in every language, but we have a diversity of language. So you can look and see if it's in that particular language. You'll see your search by keywords, ICD-9s, because we use ICD-9s have been obsolete for a while, but there's still things that can be searched by that. ICD-10s, even a CPT code. You'll notice that my age is defaulted to 18 plus because it's based off of the age of the patient. So if you have a patient who is under 12 years of age, this would be checked off. You'll also notice my gender is checked off for me too because my patient identifies as female. And then I can, based off of this, hit search. And it'll bring up my search results for this too. I can select what I want from here, and I can print what's checked. I can send it in a to-do. I could edit. I can save this as a favorite. Again, I can send this as a to-do, and here's where I can see if there's another language for it. And I can print what's in this screen here from this print button right here. This will print what's in this check mark here. So if I have a couple of things printed, a couple of things checked, I can print those all at once. This print button here will only print what's in this screen here. Now, as far as your patient education and where this opens up for you, in your chart summary, underneath your cogwheel here, if you open this up, you see this default patient education here. You can select where you want that to open up. So if you like the links feature, because there's a couple of different websites that you love the way that they explain the education for a patient, they have it in layman's terms and it's not too overwhelming for a patient, you might want to have your patient education default to links. So that way you can have it automatically open up to the links and you would just click on that link and it opens up to the web browser for you. If you want to search, you might want to keep it as your search, or you might want to open it up to your favorites. Again, this is based off of the user that's logged in to CareTracker, this here. So it's every user can be different. It's not practice-based, it's user-based. And I have mine set to search. And I just press save. Your next button here on your clinical tools is your referrals button here. This is where you can create the referral for you to send them to a specialist, or if you're a specialist, to a specialist, depending on what it is. You would select, who you're referring from, referring to. Again, you can look them up here. If they're part of a group, this is for internal purposes. If it's somebody that you're referring from group to group within inside of your group. Specialty. Transition of care will always say yes, because technically you are transitioning them to another person's care, another practice's care. So that will be yes. You can give a reason for that referral, the urgency for that referral. Follow-up complete, yes or no. Authorization, this part here, sometimes insurances will require authorization dates. They'll require an authorization number, especially when you're referring them to a specialist. Or if it's a type, it's based off of visits or amount. How many visits, how much is the amount. You might not have that information when you are creating the referral, and that's okay. It's not needed. It's just an added bonus if you do have it. And then down here is what you want to include. Do you want a full record? Do you want an encounter? And then you would select that encounter date of what you want to include with that referral. You can save this referral. You can save and print it. Of course, you can cancel it. You can send it in a to-do. You can send it via direct message. And again, if you're doing anything with MIPS, the incentive program, direct message is what they are recommending and requiring to get credit. And then you also have your log too. And your log would show anything that has been done on this particular referral as far as who created it, if it was sent or not. And you also have your authorizations here where you can create a new authorization if need be. Now, after the referrals, you have your E&M and you have your visit capture. These two are PM-based, but they're within inside of the clinical record. The E&M evaluator, if it is turned on, that's a practice specific, if they want it on or not. They can be, select which type of patient it is, based on the guidelines. If it's got 3 or more chronic conditions, the history level, exam level, they can hit calculate and it would give you a recommended code. Now again, the key word there is recommended. Does not have to be used. It's a recommended code. So if you don't agree with it, you can not use it. If you do agree with it, you can select it. Then you have your visit capture, and I'm going to come back to that in a minute because I want to come over here. You also have a screening, so you can complete screening as well. It's an interaction screening if you needed to. You have your print button. Now the print button will change as you go out through the system, but here you'll be able to print out your chart summary, a formal health record if you needed to, so you'd be able to print that out here. And then you also have underneath your view, you're able to view the CCD for a patient. You can view a clinical log. You can also access your links from here as well, too, if you needed to. It's just another place where you have that capability of accessing the links as well, depending on if you're in education or over here, too, as well. And then again, like I said, your visit capture. Your visit capture is your electronic billing. Instead of having a paper encounter form that is in the room when the patient's there and the provider checks off what the diagnosis code is, what the CPT code is, could even put in the duration of how long, counseling was, and then gives that to the patient, and the patient goes out to the front desk and checks out, hands that to the person that's checking them out. This is your electronic version of that. And again, this is PM based. This would be set up on the PM side, but it's used in the clinical side. So that way, if you are coding your visits, you can code it from the clinical side as well. So again, here you have your procedure. So you would select the procedure code. Then you would come in and select your diagnosis code. The top here is the active diagnosis for the patient. Below that is common diagnosis codes that were set up for the practice. And then you have your visit summary where you would review it and you can save it. So that way it goes over onto the PM side and the biller can now pick it up and do what they need to do to send that out to the payer. And then once that is closed, it does close the record for you. Once you save that, it will close the record for you. And that concludes our video on clinical today.